Hello and welcome to another session from HT Spotlight. Today's discussion, brought to you by Sanofi, the leader in vaccines for both children and adults, is around how to protect your child's health this monsoon. Keeping children safe and healthy is something that every parent worries about. The need of the hour, of course, is improving pediatric healthcare infrastructure and protecting children against this pandemic. But there also needs to be a better understanding around how to help children stay healthy, both physically and mentally, till the time they get the vaccine and what to do after they get their shots. For instance, state governments across the country are cognizant of the risks to children, especially as schools reopen, and states are discussing steps to keep seasonal infections at bay even as we battle COVID 19. The reasoning here is that seasonal infections like flu and COVID 19 have overlapping symptoms, and protecting children against the former will help decongest hospitals and avoid unnecessary testing for the latter. But as a parent, one might wonder how effective are these flu vaccines, or when it would be safe to send children outside, or how should it be worked around other vaccines for routine immunization. Now, to address such questions and more, we thought of bringing to you a conversation that involves both a parent and a pediatrician so that anyone watching could get a better idea of how to plan for their child's health in these difficult times. I'm your host, Gautam Srinivasan, and joining me in this conversation are Tiska Chopra, prominent actor, writer, film producer, and a mother, and Dr. Vijay Yevle, one of the finest pediatricians from the city of Mumbai, who was also the former president of the Indian Academy of Pediatrics. Tiska, Dr. Yevle, great to have you with us. It's a conversation which is going to be relevant to a lot of people watching, a lot of parents watching. It is something at the top of every parent's mind. So let me start off with you, Tiska. You being an actor, a filmmaker, an author, and also most importantly a doting mother to young Tara. What are you doing to keep your daughter in good health during this pandemic, both physically and mentally?
Gautam, hi. Hi, Dr. Yevle. Thank you for having me, Gautam. And I have to say, this has been a very trying time for parents. Mentally, of course, to keep the energy of a 7.5 year old, which is what she was when the whole situation started, was extremely difficult. And with them not going to school, trying to get used to online schooling, all of that, everyone's gone through it. It's tough. But even more important is the looming threat of the multiple infections that come with each changing season, and kids are very, very prone to that. Sniffles, snivels, flu, all of that becomes extremely taxing for parents because they're so tiny and they're so fragile. And as a parent, you feel that, I mean, they're extra vulnerable. They don't have, as a parent, you want to create an armor or shield around them. So that's been very challenging. We tried to do the usual protocol of wash your hands, sanitize, you know, don't step out unless it's very necessary. When the first lockdown opened, we, allowed her just to go down in the building and meet just a very few people. But, kids being kids, how much can you?
Hmm.
So the first opportunity that I got to get her annual flu shot, I made her do that. And because I didn't want to go too many places, I told the pediatrician to give me the flu shot as well. So I took the flu shot. So, we're trying to do our best under the circumstances, and with the looming threat of COVID, we don't want to deal with other things on top of that.
Absolutely.
So,
But
yeah.
you have been proactive, and that's good to know. You had your child take the flu shot, and that's something which is not a regular occurrence. If you think about it, the seasonal flu shot needs to become a regular occurrence, and it somehow has gone out of the mindset of a lot of folks. And that's what we need to address. And as you mentioned, it's like you're protecting your child, you're providing them with an armor, so to say. And from that perspective, building immunity, Dr. Yevle, the monsoon season is here. It's a very vulnerable time. So, how important is it for parents to get their children vaccinated against diseases like diphtheria, tetanus, pertussis, and other infections which thrive in wet and humid conditions? Because as Tiska mentioned, it's about having a comprehensive armor for your child to protect the child from all the diseases out there?
Hi, Gautam and Tiska. Thank you so much for having me on this show. And I cannot agree more on what Gautam said, that it's so very important to protect your child from different vaccine preventable diseases, we call them. And let me tell you that no other tool other than the safe and potable water has been so effective in preventing diseases, infectious diseases in children. And we have gained so much. I'm sure very few of our viewers have seen smallpox. It's only because of the vaccine that we could eradicate it. Polio is
Hmm.
almost on its way out. So there are so many diseases, and it's a wonderful thing that vaccination is birthright of every child, and there are so many vaccines. And I mean, many times parents wonder how many pricks my child will get. But trust me, these are the vaccines which have gone to prevent so many deadly infections in children. And it's very, very important as monsoon approaches. Monsoon is already at the doors. And you have lot many monsoon related illnesses. And luckily, we have a good number of vaccines available to protect your children from these vaccine related diseases. And I would definitely urge and make an appeal to each and every watching this show to spread this message and ensure that the child is up to date. What has happened during the COVID pandemic? We
Hmm.
all have been locked down. We did see little unlocking in between, and again we are gradually unlocking ourselves. And parents somehow are little skeptical and scared of visiting a doctor's clinic. But trust me, I mean, enough precautions are taken by all the doctors, and you must now catch up with the missed vaccination, and let us not lose on the gains that we have achieved by vaccination.
That's a fair point. That's a fair point. And this is also a reminder to those who are watching that in case you have questions, you can drop it in. And at the end of the discussions, we'll take a few questions addressed to any of our speakers. But taking the point that Dr. Yeble mentioned and coming to you, Tiska, as a parent, what are your major concerns in taking your child to hospital in such times? Because the worry will always be there, right? You will always wonder, if I take the child to the hospital, is there going to be more problems coming my way? There might be a thought like that for a parent. So what are your major concerns, and how do you address them as a parent?
Oh, that is a nightmare. I mean, there is no other way to describe that for a parent. Taking their child to hospital in general is a nightmare, but taking them to a hospital at a time like this is I can't even like imagine it. Unfortunately, we haven't had to. Uh, thank God. But I'm just saying that you know most hospitals have COVID facilities, and uh, because the child hasn't had their usual immunity that they would have, because they're kind of meeting other children and all of that, that
Hmm.
isn't there. They haven't stepped outside the house for the most part of a year and a half now. So it's frightening to think that one would take them to a place like a hospital, which is normally you know infections running rife. We've heard of so many things that have happened on account of people going to hospitals at a time like this, and you would want to avoid it at any and every cost.
Hmm.
So we actually spoke to her pediatrician. We sat outside in the car. We waited until the doctor gave us the green signal and said there isn't anybody else actually, and there was only one other person who was there in that for that appointment slot. So we waited in the car, and
Hmm.
once he gave us the go ahead, and then we went in, and there was nobody there, and we were masked and we were gloved and we were all of that because. Um, you don't want your child to fall sick. That's your
Hmm.
first and prime duty as a parent. And I'm not even talking just only about duty. I mean, you don't want your child to be sick.
Hmm.
That's what you do as a parent. You protect them, you guard them. And so taking a child to the hospital is a no-no, unless, I mean, of course, it has to be done. I would definitely make sure that I went to the pediatrician and got them their
Hmm.
usual shots and vaccinations that were needed for that time, and not
Hmm.
miss out on those regulars, which the kids get their usual. The younger ones get the rotavirus and all of the others, and then their other
Hmm.
vaccinations. Very important to not while COVID continues to be the theme of 2019, 2020, 2021.
Hmm.
you can't forget that we still live in a hot tropical country, and there will be the regular flus and everything else that's floating around. So you have to make sure that your child is protected.
Hmm. Fair point. And as I heard from you, there was also an element of planning involved, right? When you take your child, now you are as a parent are more cognizant of when you take your child for visits, even if it's a routine visit. You plan that visit to make sure that nothing goes wrong. But taking forward that point to you, Dr. Yevle, is it safe to get children vaccinated in lockdown conditions? What measures are you taking as a doctor to help your little patients stay safe?
Okay, while I totally agree with the anxiety and apprehension that Tiska and the mothers have about their children, especially the risk of contracting, uh, such a highly transmissible COVID infection when you start in a healthcare setting. However, let me tell you that most of the pediatricians, if you have seen that the inpatients uh, in pediatric population with COVID is hardly, it's almost negligible. Number one. Number two, most of the doctors they have uh, planned their vaccination or immunization sessions at a different time from their regular clinics. So you have well babies visiting the clinic for vaccination. So that way one could minimize the risk of transmitting infection. Secondly, these days, most of us would call patients by appointment, see that there is no overcrowding. We also inform the parents to, as far as possible, we ask them to, accompany only one parent to accompany the child, preferably someone who's young. And now that we have already started vaccinating against COVID, the adults, we prefer someone who's vaccinated. And these parents, again, those who accompany the child need to mask themselves. And at all the clinics, we have hand sanitizers displayed at the entry and at the reception. There is no long queue, and the all the due precautions are taken so as to prevent them. And another thing that we are doing is remember, our body is capable of handling many antigens or vaccines in one go, and a lot of children seem to have missed out on their regular vaccines. So we make it a point to combine and use as many vaccines as possible in the visit that the child is at the clinic, so that multiple visits are prevented. That way, the parents are pretty. Once you counsel them, once you talk to them, and assure them of good infection control practices at the clinic, they are pretty comfortable. And then there are big hospitals like say Apollo hospitals where I practice. You have totally different passage and entrance and corridor for COVID patients. Though it's a hybrid hospital, proper precautions are taken to maintain infection at away, and good infection control practices are followed. So I would once again urge all the parents not to be scared. Trust your doctors, call them up, take appointment, and please take your children to the clinics for their routine immunization.
Indeed,
Yeah.
that's a very important message. And considering we are talking more about the seasonal flu as well and the need to take care of it, Tiska, do you have anything to ask to the doctor? Because as
Yeah,
we said, the
I
the vaccination of children, especially for the seasonal flu, needs to be done so that at least it gives them a fighting chance. Any questions that you have to the doctor, Tiska?
Actually, I do, Dr. Avery. I wanted to ask you that, while I've got Tara her flu shot, I was in two minds and I checked with her pediatrician. So I wanted to know that while they're at home, the chance of them picking up an infection is extremely low. We still need to give them the flu shot, right? Because
Yeah.
flu can be picked up anywhere. And how efficacious is this? How useful is this in the time of COVID? And how helpful is this for a child, actually?
Okay, now let me tell you, COVID is only 2 year old, but flu has been in the air for last several decades. If you remember, the first flu pandemic occurred almost 100 years ago. And
Hmm.
ever since that, there have been flu viruses in the air, number one. Number two, so it's not a new infection. Children are extremely vulnerable and susceptible. They contract flu. And unlike COVID, flu can lead to severe infection in children, especially children who are, very young, less than 5 years, 5 to 8 years. And so these children, and then you have lot many children in the society who live with their chronic diseases, chronic kidney, liver, heart diseases. Few children are diabetics. Some of them are very obese these days. And these children are at an additional risk of contracting severe influenza infection. If you look at the what you say is absolutely right that the children have been indoors and the incidence of flu has gone down. But why? Because like flu, like COVID, your flu is also a respiratory infections, and the risk mitigating measures that we adopted of masking ourselves, sanitizing our hands and avoiding going to crowded places has helped a lot in keeping flu also at bay. However, we are not going to be locked down forever. Schools are going to be open, and children will be back to school, back on the playgrounds, and will start going to malls and restaurants. And the flu, which has gone to has taken a backseat. So this lull is going to be over. The moment we unlock and start coming out, the flu is not disappeared from the air. It's not finding the vulnerable people to catch. So once we are out, the flu is bound to be there. So regardless of the fact that we have had very few cases of flu, it is desirable that all kids take their flu vaccine and you take and protect them from the flu, which can be really severe in young children.
Yes. Sorry, Gautam, I'm going to jump in with one more question. I'm
Sure.
hogging the good doctor. Uh,
No worry.
as I jumped in onto the pediatrician and I told him to give me a flu shot as well, was that wise to do? Because I just
Well,
wanted to make sure.
see, if you look at the Western world, it's a universal recommendations. In our country, we have competing priorities. However, flu is one. Children are definitely they suffer and they pass it on to adults, and adults also suffer. By and large, though young adults have a benign course of flu, as you age, the risk of again getting a severe disease increases. And then again, as I repeat that lot many individuals on this earth today, thanks to the advances in medical science, are living with chronic ailments. And flu can really be disastrous in these vulnerable group. So yes, it's a good thing if you can avail of those for yourself, and you have done the right thing. And
Hmm.
if you look at the recommendations which are made in our country, we have one Indian Academy of Pediatrics which recommends vaccination for all the individuals or for children, and then you have recommendations from the Ministry of Health, and both
Hmm.
recommend flu vaccination in children. And the IAP also goes on to say that pregnant women they must vaccinate, they must be vaccinated against flu because flu cannot be used on a very young infant who is less than 6 months of age. So how do you
Okay.
protect them? By vaccinating a pregnant woman so that the readily available antibodies are passed on across the placenta to the neonate. And then you
I
also
didn't know that.
vaccinate the healthcare
Okay.
workers. Yeah,
All right.
Trishka, you said.
That is an important question right there. Would
No,
you
no,
advise parents of small children, especially those under 1 year, to take their child for the vaccination? They can't wear masks, and considering they're developing immunity, what should they do to keep them safe as they step out for vaccination? Then.
If you look at the recommendation on using of mask, a child less than below 2 years of age did not wear a mask.
Hmm.
And between 2 years and 5 years, it is sort of permissible, mask wearing. However, a child above the age of 5 years must make it a point to wear mask. I repeat that what is important from COVID prevention of point of view is if we protect ourselves, our children are automatically protected because it comes from us. So suffices to say that the accompanying adult parent should mask, should observe hygiene practices, and go to a clinic with appointment, regardless of the fact that if the child is able to wear mask or not.
Doctor, I'm sorry again to jump in, but I just quickly wanted to ask that there is one thing that we already did, which is to sort of make sure that when we went to our pediatrician, that I checked with him, I made sure I called his reception, made sure there was nobody there. Tara and I both were masked, we were gloved, we didn't try not to touch anything, all of that. But is there anything else that one can do when one takes one child to get vaccinated for the flu, to get their what we commonly call the flu shot? Uh, is there anything else that I could do? Because I was constantly thinking at that point, is there anything else that I could do, should do, any other way to protect my child?
One is you must go through the vaccination record that your doctor gives you. And you must utilize the opportunity that you visit the doctor for flu shot to ensure that other pending shots are also done with in the same visit. And apart from this, infection prevention control practices, masking yourself and going there with prior appointment, I don't think anything else is required. And of course, unless the child is down with some major illness, there you need to postpone the vaccination. Otherwise, minor ailments like mild cold cough is of no concern, and you could, jolly well go to your doctor and see that the flu shot is administered to your child.
All right, we are heading towards the final leg of the conversation before we shift to audience questions. So let me just get a few follow-ups. Doctor, what steps should parents follow post the vaccination to make sure that the child is comfortable?
Well, flu is a reasonably safe vaccine. By and large, there is no adverse events or side effects with flu shot. At the most, a child may have little pain at the site of injection, and very, very occasionally, a child can get mild fever. Otherwise, it's a very safe shot to have. You don't have to really take any additional precautions. It is like any other jab. And secondly, remember, it takes about 2 weeks for the body to mount an antibody response. So, and come monsoon, you start seeing flu and flu-like illnesses. And we see a lot of flu in monsoon. So, if at all you plan to vaccinate a child against flu, now is the time. Ideally, it should be done before the monsoon, begins. And that is the time when a fresh vaccine. Remember, flu is an annual vaccine. And every year you have a fresh vaccine. And that's why not that you have done flu shot this year and forget about. No, it's an annual repeat vaccine, and you must do it when the schools are closed, just before the schools reopen, so that your child is protected against flu during monsoon.
All right. And considering, there's always that saying that history has a habit of repeating itself. I'd like to get a message to viewers from the both of you. Considering, and I was just reading an article which quoted a Lancet study. This is 10 years ago, where India topped the list of the flu virus affecting children, and the cause and the effect which it had. So, considering the fact that we should never forget the past, what is the key message that you would like to say to parents using this as a platform? We'll come to Dr. Yeble first, and then to Tiska, and then we'll go on to audience questions. Dr. Yeble?
Well, I would only say that we are going through an unprecedented, testing and trying times. Uh, yes, COVID threat looms around, but not to forget the routine infections, which are also not uncommon. And we have very effective tools to prevent these infections, that is, vaccines. So take due precautions, take care of physical health of your child, and at the same time, you must, as Tiska mentioned in the beginning, that you must also look into their mental health. These days, children are locked in. They are not aware of what is happening. They're not seeing their friends. They're not schooling, and they are absolutely lost. So try and engage them in some routine activities, household activities. Talk to them, play with them, have fun corners in the house, connect them with their friends on Zoom or connect with relatives, and celebrate small occasions like their birthday, so on and so forth. So look after their mental as well as physical health. And the best way to look after physical health is good nutrition and vaccination. Vaccine is the birthright of every child. So see that your child is protected against all the illnesses, especially during monsoon. See that the child is given influenza vaccine.
I think that's a key message, that the vaccination is the birthright of every child. Good health, good nutrition is the right of every child. Tiska, what would you like to say to parents out there who are watching this presentation?
Well, I'd like to say 2 years ago, I was hospitalized with influenza. And my doctor, who was attending to me at that time, asked me, "So you haven't got your flu shot?" And I was like, "Oh, no." So she said, "Can you tell me why?" So I said, "Nobody told me that I'm supposed to get a flu shot." So she said, "You are talking to me as if you're not even an educated person." And I was like, "What do you mean?" She's saying, "You're suffering, you're in hospital because you've got the flu. The full form of flu is influenza, in which we call it flu. It's become a generic term, but it's actually influenza." and I suffered a lot. I was in hospital, and I had to take a lot of medication to get better, and the medication actually made me sicker. Post that, every single year without fail, and my daughter was actually on a program with her pediatrician, so her flu shots were taken care of. And so when I saw the opportunity, I didn't want to go to any other place, and I told the pediatrician only to give me the shot. So I think that, a part of what we are doing today is also telling people that the flu can be mild, but it can also be extremely severe. It can be
Hmm.
very, very painful and torturous. The cough that comes out of that is very close to swine flu. So, not meaning to scare anyone here, but I've been through it 2 years ago, and it is a disaster. You are left weak and exhausted. So, I would
Hmm.
recommend that everyone, adults and children, please get your flu shots, because this will save the day, literally. And it's all of these upper respiratory disorders mirror each other. Similar symptoms for COVID, similar symptoms. So, one, you could mistake one for the other, etc. So, best that what is in your control, uh, you should take it. So, please take the flu shot. I have learned my lesson. I make sure every November is my time. I will go. I will take it without fail. I think it to my birthday, so I won't forget it.
That's a good way to remember. But a very important message nonetheless. Knowledge is important, because once you have the knowledge of what's out there, you have the power to deal with it as well. Let's go to some audience questions and see what they have to ask. This one comes from Sohini Roy, and she asks, is flu vaccine a one time affair? And what about vaccination for older kids or teenagers? Dr. Yebla, you want to take this for us?
So I would again repeat that influenza is a specific disease caused by a virus called influenza virus. There are four types of viruses which are in circulation. There is a vaccine which comes every year. What is pertinent and more relevant for the setting in our country, most part of our country, is to take this vaccine just before onset of monsoon, sometimes mid-May or so, so that you have 2 weeks for the antibodies to mount. It's an annual shot. It's a vaccine which would prevent influenza in your child. It does not protect against your coronavirus. The common cold or allergy that you get is not influenza virus. Influenza is a specific virus, and this disease tends to be severe in young children and children who have chronic diseases of their organ system, like heart, kidney, liver, diabetic children, obese children, and healthcare workers. We doctors, we need to protect not only ourselves because we come in contact with flu patients, but also it's our responsibility. The onus is on us to ensure that we don't pass it on to the little ones that visit us. So that, in nutshell, is about flu vaccine. It's a very, very safe vaccine, available since last several years,
Hmm.
and it is desirable that all children take this vaccine.
All right. The next question comes from Chirag Gala, and he asks, whether the flu vaccine should be given in every season to deal with the influenza, or should it be given in COVID times, or it has to be given in all different seasons? So I presume he's asking whether it's a once in a year affair, or are booster shots at a higher rate necessary considering the times that we live in.
So I said
Good
it is an
question.
annual shot. However, it is more important to take it this year from the uh, viewpoint that, see, there is an overlap in the symptoms of flu and other respiratory viruses, including the coronavirus. So imagine a child having flu-like symptoms. Unless you test him for either influenza or COVID, you would not know what the child is suffering from. Number one. Number two, this would put an additional burden on testing resources of the healthcare system. Secondly, a young child, if he contracts flu, has an increased risk of getting hospitalized. That would add to the burden on the healthcare system again. So we would want to decongest the healthcare system as much as possible, especially during COVID pandemic, so that we are well prepared and geared up to manage COVID. And we don't want the child to suffer from one which is preventable. So there is a very effective vaccine available to prevent influenza. So especially in young children, and Indian Academy of Pediatrics says up to 5 years, Ministry of Health says up to 8 years, these children should
Hmm.
be protected against influenza by taking the annual flu shot.
All right. Our next question is that is pre-monsoon a good time to take the flu vaccine in India? I guess people also want to kind of understand the schedule as to the moment you know that okay, monsoons are coming up. Is that an automatic cue for you to take the flu shot for yourself as well as your child? What's your answer to this?
Yes, yes, pre-monsoon is the best time because we see a lot of flu during monsoon, except the northernmost tip of our country, that is Jammu and Kashmir, and the southernmost tip, where we see more flu during winter months. Otherwise, just before the beginning of monsoon, during your summer vacations of the child, that's the best time to take flu vaccine. And now is the time, you must protect.
Hmm. All right. The next question comes from Krishna Samal, and he's asking whether what's the remedy for seasonal issues like running nose and allergy and aches, and whether this flu shot also covers all of those.
No, I repeat that flu is specific for influenza virus disease, but
Hmm.
apparently they look alike. So, first
Hmm.
and foremost, whenever you have flu-like illness, you must consult your doctor and make sure that what the child is suffering from. Fortunately, most of these illnesses they require only symptomatic remedy, like some paracetamol to control temperature, some nasal drops to see that the child's breathing is comfortable, and unless the child is very young and has accompanying disease, by and large, the children get well with this remedy. But the issue today is in the nuclear family with the pressures at the school. Every parent wants to send the child back to school as early as possible. Remember, flu is an infectious disease. The moment you send your child to the school or to the playground, there is a risk of spreading flu to other children. So make sure that the child recovers and then only he is back to school.
All right, another question and very relevant. After taking the COVID vaccine, how after that, how many days can the parents and the children take the flu shot?
Well, when COVID vaccine, we started vaccinating against COVID, there was an advisory to wait for 4 weeks. However, now it has been cleared by the CDC that the COVID vaccine can be treated like any other vaccine, and you can have other vaccine at any interval. It can be given on the same day, a week later, a fortnight later, or a month later. But I repeat that while COVID is important, we must prevent COVID, but at the same time, your routine vaccination is as important as protecting the child against COVID. So I repeat, ensure that your child is up to date on his routine vaccination, including your flu vaccine.
All right. On that note, we'll wrap up this conversation. Thank you so much to Tiska and Dr. Yeble for joining us, and of course sharing your thoughts, your insights on the topic. And I guess as India enters its partial unlock mode, it is imperative for parents to keep children safe from the pandemic till a pediatric COVID-19 vaccine is tested and approved for India. Let's all make sure that all the other shots are up to date and the flu vaccine is also taken before the monsoons. I'd also like to thank Sanofi Pasteur for bringing us together for this conversation. Sanofi Pasteur, of course, is a world leader in vaccine and has given us this opportunity to understand the value of vaccination for both adults and children. Of course, if you're watching this and you want more information on protection from the flu, you can visit the link which is coming up on your screens. And of course, to search for a vaccinator for adults, you have another link which will be coming up on your screens. You can use all those references and get more information to deal with the flu virus. And of course, as you've heard on this panel, knowledge is power. The more you know, the more you are better equipped to protect your child and yourself. On that note, we'll wrap up this conversation. Thank you again to everyone who's tuned in. This is Gautam Srinivasan signing off.
Thank you, Gautam. Thank you, Disca.
Thank you.
Thank you. Thank you, Gautam. Thank you, Doctor.